Good morning, everyone. This is Sarah Myers. It's delightful to see a number of people joining the call on this warm July day. I know people are busy this month, folks are on vacation, but it's really neat to see some of the names that are popping up. So thanks for joining us, and I'm really excited about today's call. We're going to give it just about one more minute for folks to join, since I do still see some names popping up. So I'm going to go ahead and we're going to have a little fun in the chat box. Oops. It's a little fun in the chat box today. We're always talking about ICN and IED and work, but you know, as you all know, we like to get to know each other as people a little bit. So if folks could take just a second and type in the chat box, what has been the highlight of your summer so far? And maybe it's an ICN related thing, maybe it's a work related thing, but maybe some of us have some other interesting things that have happened this summer. So I want to give it just a second. I'll read some of them off. And then we're going to try to go ahead and unmute folks for most of this call if the group stays small. But for now, let's just use the chat box for this. Oh, Serena had a trip to the Outer Banks with family. That sounds very good. When I lived in North Carolina, that was one of my favorite places to go. Going to the beach. I see a theme here. Janine went to the beach. Sending my kids to camps. Yes, Jessica, that's a good one. That's one of my highlights too. Trip to Key West. Roger, Amy went to Kiowa Island. Jamie bicycled around Minneapolis visiting all the breweries. You guys have much more exciting summers than I do. I need to get out of my home and my town. Anyone else? Jamie, how many breweries did you visit? Can you go ahead and type that in? 8. Wow, that's an impressive bike tour. Anyone else want to add any exciting summer events that they've had? Teresa, Todd, you always have something to add. I haven't seen you type in the chat box yet. Maybe she hasn't done anything exciting yet this summer either. All right, well, thanks for diving in and doing that. It's always fun to see what people are up to. So we are going to go ahead, since we have a pretty small group today and what we hope will be an interactive call led by some great speakers, we are going to try to unmute everybody. I'm going to get through my little introduction first, and then we'll unmute everybody. But we are going to ask that you keep your phone personally on mute, or if you're using the microphone on your computer, that you keep it muted, just so that we don't hear any background noise when you're not talking. But hopefully we'll have some discussion. We'll be able to, you know, you guys will be able to unmute yourselves, and we'll see how that goes. If we're hearing a lot of background noise, we may need to change that, but we'd like to try it today. If you have other people at your care center with you who are not the person whose name is listed on the GoToMeeting, if you could go ahead and just type in the chat box who has joined you, so we have a good sense of how many folks we have listening in, that would be fantastic. And just the usual reminder that today's call is being recorded so other people can listen to it and benefit from it. But again, we're thrilled to have you all here in person. Pretty concise agenda today. Quick welcome, and then really the bulk of our call is going to be spent hearing from some guest speakers about best practices for patient and parent volunteer recruitment. I am very excited about this. I know we've had a lot of focus on engagement over the past couple of years, a lot of discussions and good breakout sessions at the community conferences about parent and patient recruitment, but I'm really excited, having seen the slides and tools that are going to be shared with you today, that we've really advanced in our thinking, our examples, and the stories we have to share about how people are really in very concrete ways growing their patient and parent community. So I'm very excited about that. And we'll just end with some quick kind of notes. I would not want to start this call without sharing that we have continued to basically maintain our wonderful progress around our remission rate. It's stayed the same for quite some time, but we are just under 82% currently. So congratulations to all of you for being a part of that. I also wanted to share some kind of good news, and we're getting a little bit of background noise. So if somebody is not muted on their end, if you can go ahead and mute your phone. Thank you. I also, in addition to data, stories about what you're actually doing at your care centers are really important, and in some ways can be more instructive and interesting. And so I pulled a couple of things from the narrative reports this month that I thought were really exciting. I don't think we have anybody on the call from Alabama, but kudos to Alabama, because they noted in their narrative report that their first educational webinar was a great success. They had 36 people participate. So that was parents, patients, and others that dialed into a webinar to hear what Alabama had to say. And this was, as they said, a huge improvement over their in-person IBD Education Day. We've been hearing a lot that people are thinking of more ways to kind of reach parents and patients across the miles and virtually. And it is a nice link to the content we'll have later in today's call. But a huge congratulations to Alabama for testing that and for keeping track of the data so they can learn from that improvement. So great job. Vermont noted that they had a goal last month of 75% of pre-visit planning forms not only would be reviewed and pulled from kind of the system, but that would be reviewed by the actual provider prior to the patient visit. And they reported in their narrative report that they actually achieved that, which is really great. I love the focus on pre-visit planning, especially after we've been focusing on it a lot at our community conference and in other venues. And Helen DeVos, again, in line with the theme of today's call, we're very excited to report that they've gone through volunteer services and are now able to have a parent who can talk with new patient families. So sort of a buddy system, mentoring system that they had not been able to do previously. They're just starting to work, as you can see, on getting her name out and are going to, again, using good ICN data principles, our principals are going to track how often she's called and emailed so they can learn from that. So we're really excited about those updates. Again, very in line with some of the issues that we're going to talk about on today's call around parent and patient recruitment, and it's just really great to see that. I did have to mute a few people just so you know because of background noise, so I just want to remind you all to keep yourselves muted if you can for now. We'll unmute every, if we have to mute you, we'll definitely give you a chance to kind of raise your hand or put in the chat box if you have a question later so we can unmute you. And then finally, in terms of kudos, you know, we especially the more experienced teams in the network, it can be really easy to kind of get out of the habit of doing PDSAs and using that kind of structure for the work you're doing. And a lot of you have a whole lot of improvement and changes to test happening at your centers, but you don't always go back to that PDSA structure. And I noticed this in the narrative reports. UCSF actually structured their narrative report around the PDSA model. And so as you can see, they focused on population management. Their test last month was that population management meetings would be split up and be more specific in order to provide appropriate management for specific groups. The do part was that they split it into a diet-specific meeting, an ICN homework meeting, which was things like reviewing patients that hadn't been seen, patients on the exception report, so kind of a cleanup process, a research-specific meeting, and a patient and parent outreach meeting, which may sound like a lot of meetings, but I think they were more targeted and focused. And what they said is, when they sat down to study it, this more focused approach led to more productive meeting time. We're also able to better track patients who have not been seen in 200 days and deal with some missing data issues. And so what they said is we'll continue to have this monthly rotation of more focused PM meetings. So I wanted to share this just as a plug for kind of returning to that PDSA model, even when you're a more experienced center that maybe has gotten away from that. And I found it very helpful to understand what they were doing when they used that format. And I think it's a nice way to be able to share with other centers, you know, we had this idea, we tried this, here's exactly the steps you can take through a PDSA. So congratulations to UCSF. And finally, before I hand it over to Michelle, instead of saving some of the general updates for the end of the call, when I hope we'll have discussion about the guest speakers content today, I do want to remind folks the community conference registration form went out this week. The specific link is included here in the slides, so you'll receive it this way too. We hope many of you will register. We can't wait to see you in just a few months now. It's really coming up quickly. And then specifically, I want to highlight the parent scholarship process this time. As many of you know, we have slightly more limited funding this time, as we do not have Crohn's and Colitis Foundation funding for parent participation. However, we took the initiative to do some fundraising, ICN-led fundraising. We were very lucky and fortunate, and we're very grateful to have raised enough funds to cover a number of parent and patient partners. Our first priority this time, because we have a lot of new parent and patient leaders in the Parent Working Group and Patient Advisory Council, is to make sure that the leaders receive scholarships so they can plan and really make those groups as effective as possible moving forward. So we do anticipate up to about 10 slots for additional parents who want to fill out the scholarship form. The one thing I really want to highlight here is that we have an option this time for parents to indicate that they would like a partial scholarship covering just conference registration versus a full scholarship. And if we have enough parents select partial scholarships, we may be able to cover more people. So I just really wanted to flag that and encourage you to get this to parents quickly. The form is due at the beginning of August. And again, you know, the sooner we get people sign up, the sooner we'll be able to kind of review those scholarships and do some decision making. So that link is included here as well. It will also be shared through the parent working group. So just a really important note, very timely note. So without further ado, speaking of parents and patients, I am going to go ahead and hand it over to Michelle. I will let Michelle Spots introduce herself and Jessica, but I am very delighted, like I said, to be able to be focusing on content that we've been working to develop for quite some time, but that they have really taken to the next level and I think made incredibly concrete and useful. So thank you, Michelle, and you should be able to take the screen now.
Hi, Sarah. Thanks very much. Hi, everyone. It's great to be here today. Can you all see my screen and hear me okay?
Yep, you sound great.
Great. Thank you. All right, Jessica, do you want to start out by introducing yourself?
Although, Michelle, let me just say, the view that we have of your screen is the not the slideshow view quite yet. It's still, you can see that little next slide thing.
Okay, thank you.
So maybe you need to click to just get out of presenter view.
All right, thank you. One moment, I'm going to pause my screen and figure this out. And Jessica, feel free to start introducing yourself while I do that.
Okay. So welcome, everybody. My name is Jessica Perrick, and I'm a parent in the Improved Care Now network. Thank you all for coming today and learn with us what best practices for volunteer recruitment. Michelle?
Hi, everyone. This is Michelle. I am an engagement coordinator with the ICN network, and I also have the opportunity to be the liaison with the parent and patient groups of Improved Care Now. So it's just such a joy to be here today, and I apologize. We are still working on the technical issues. Are you seeing the right screen now?
Yep, perfect. You just got it.
All right. Wonderful. Thank you.
So first off, we'd like to take a poll on who's on the call right now with us today and what your role is in ICN. So if you can take a look at the poll on your side of your screen, whether you're a doctor or a nurse, coordinator or parent patient, or are here in some other capacity, we just kind of want to get an idea of who's here with us today. A lot of coordinators and parents. Awesome. So second poll question, how many of you have parents or patients involved at your care center? Or yes or no? Do you have people? Yes, yes, no? It's still fluctuating. So about 2/3 of you have parent and patient participation. So I think that's great. So today we're going to cover the following: how to identify prospective volunteers, how to share information about ICN with prospective volunteers, how to make the ask and invite prospective volunteers, how to track volunteer onboarding and follow up with new volunteers, and setting a 90-day goal for recruitment, for recruiting parent and patient partners at your center. We'd like to share some helpful resources that you can continue to use at your care center. So we've put together a volunteer recruitment toolkit, which you'll be able to find on the ICN Exchange. We'll refer to this toolkit throughout the training as it contains many of the recruitment materials that we recommend. So let's start out by talking about what qualities and characteristics you might look for in a parent or patient that might make them a good volunteer. So in your chat box, if you could please, what do you think, what makes someone a good volunteer? What do you think? Get your little typing fingers ready. And my chat box is being funny. Desire, drive, initiative, yes. Enthusiasm. You got to be excited. You got to be passionate and engaged. Now, second question, reliable. That's another one. Good one, Jamie. Second question, what qualities might you look for when you're looking for a parent or patient partner? Kind of the same, but different qualities can be different, especially when it's somebody that you've just met. So what qualities might you look for when you're looking for a patient or parent partner? Someone with free time. I think that's a huge one. Somebody that's reliable and caring, sensitive. Awesome. So these are great examples. So on your screen, we have some other examples that we came up with. The important thing to note is that everyone can be a good volunteer. Everybody has talents and interests to bring to the community. And the key is in working with parent and patient partners to find a volunteer role that's a good fit for your center's community. So next chat box question. Where would you look for parent and patient volunteers? Where do you look? Where do you find somebody? I know it can be hard sometimes to get help because of HIPAA restrictions, but Jennifer says the clinic, you know, if they're sitting in the waiting room. Parents of current patients within our own center. Awesome. So these are great places. Again, on your screen, we have some of the other places that we recommend you look for volunteers. Like you said, in the clinic, during infusions, IBD education days, fundraisers and events. Maybe you can post something in the office. Maybe you have a social media website that you can do, or an email list or newsletters. All of these are great options. Haley says she's working on infusion room parent and patient recruitment. Awesome. Michelle?
Great. There's some great starting points to look for volunteers and find them in your day-to-day work. We're going to talk a little bit now about how to approach those potential volunteers, how to give them a background of ICN, and then how to talk to them about getting involved. So as many of you know, Improved Care Now is a very large and complex organization. And so it can be tricky, at least I've found in my experience of working with parent and patient partners, it can be tricky to find the balance of sharing what Improved Care Now is and does with the parent and patient partners while still not overwhelming them. So we want to offer some recommendations of where to start, some talking points to start. So on your screen, you can see that we have a couple lines that you can use to explain what Improved Care Now is. And we also recommend taking a look at the Improved Care Now website. There's a page called the Medium Branding page. I find this to be really helpful because it has listed a number of our resources about Improved Care Now, such as the ICN Trifold brochure, the ICN infographic, and the Join Our Circle flyer. So whether you're sharing that link in a newsletter or whether you're downloading some of those resources and actually putting them up around your center, those are really great ways to start introducing the basics of the Improved Care Now network. I also want to put in a quick plug here for some upcoming events that we have. We're testing in July, offering webinars called Welcome to Improved Care Now virtual info sessions, and these are really great opportunities to direct new potential parent and patient volunteers to these webinars. They will take place, one will take place on July 20th and the other will take place on July 26th. You can find the RSVP information on our website. And these, again, are just a really great way for parents and patients to log on and learn a little bit of basic information about Improved Care Now, ask some questions, and get to know our community a little bit better. So that being said, while it's really important to share the basics of Improved Care Now, we also think that Improved Care Now is a lot more than facts or figures. Obviously, our success and improvements in care are vital, but we wouldn't get there without the people that make up the network. We also think that sharing personal stories is probably the most compelling way to involve parents and patients in the network. So we recommend, as you're talking about Improved Care Now, that you incorporate your own story of working with Improved Care Now as much as possible. This theory is a basic community organizing theory, and if you're interested in learning more about it, you can attend one of the upcoming webinars specifically about sharing your personal story. And that will also be posted on the Improved Care Now website if you're interested in that. The basic outline that we use and recommend using for sharing your personal story is to start out by sharing a challenge that you faced and what change you made to confront that challenge and what the outcome is. And finally, you end up by asking the other person to join you in your work. So Jessica, would you like to share an example of using your personal story to talk about Improved Care Now?
Absolutely, and you all will have to bear with me because I just joined ICN in April. So this is a little bit of a new experience for me, but I know my story, so hopefully I don't ramble on too much. Hi, my name is Jessica Perrick, and I'm from Dornbecker Children's Hospital in Portland, Oregon. My dad was diagnosed with Crohn's 42 years ago. I was diagnosed 35 years ago, and my 12-year-old son was diagnosed 7 years ago. I am very familiar with Crohn's disease, and each of ours is different. I've always been very open about my Crohn's, and a lot of people are not. It can be an embarrassing disease. I've had my share of moments. My challenge, though, is how do I help others overcome it and validate some of the symptoms, there are so many, and emotions that come with it. Not only have I been able to help my son, honestly, out of all of the childhood diseases he could have gotten, I'm glad it's one that I can help him with, but also with friends and neighbors. My son's gastroenterologist is aware of all of this, and in March she asked me if I'd go to an ICN conference as a parent representative for Dornbeckers. I am so glad I did this. It's given me a chance to make a difference for others that may be newly diagnosed or a family that just needs support and validation. I have a wish list of things that I'd like to see happen at our care center that we don't currently have. Tips for teaching kids how to swallow pills. 2 words, mini M&Ms. Create a Facebook networking page just for our families. Fun events for the kids and parents to get to know each other. new patient infusion buddies, or new patient and infusion buddies, getting some recliners in the infusion center for the teens. One of my other goals with one of our sister hospitals in the area is to set up a Take Steps team and have a little friendly competition to see which center can raise more money. And the biggest one, I think, is going to be the biggest challenge that I'd like to see happen in our center is getting patients set up with the pharmaceutical programs like RemaStart and having the infusion centers submit the requests, and how instead of having to go to get your bill, having to go to the billing office, get the copy that the pharmaceutical company wants to see, and try and get reimbursed that way. Those expenses are huge, but absolutely necessary. Do any of these sound like something that you'd be interested in helping with? I'd love to hear your ideas, and I would love to have you be as part of our parent working group at Dornbeckers in whatever capacity and availability that you are willing to provide. Okay, that's it.
Wonderful. Thanks so much, Jessica. I really appreciated the way that you talked about your personal experience with their own family and then translated that personal experience into community action. I also love that you listed out different kinds of opportunities for people to get involved in. As we talked about earlier, volunteers might have a variety of interests. So it's really important to make sure that there are a range of volunteer opportunities so that people can get involved in what interests them most. And I also love that you left some time and opportunities at the end for people to share their ideas about what they might like to see. So thank you. Really appreciate that you're sharing that. So again, just to kind of wrap up this idea that sharing personal story is probably the best way to get people interested and excited about improved care now. The training for this particular topic will be on August 22nd. So I'd encourage everyone to check out the events and opportunities page to RSVP for that event.
So by now, the prospective volunteer knows a little bit about ICN and has been inspired by your story. It's time to make a specific invitation. We call this making the ask, and it's important that you're specific with this. If you know of multiple ways of getting involved, try to match the volunteer with one that might match up with an opportunity that might match up with their interests or skills. It's helpful to start out with like a wish list of what you want to see, and then work together to revise and update in conversation with the role. You may want to customize responsibilities of a role to match the availability of a customer. So again, making the ask. You have to make a concrete ask. You have to ask for what you want. People are not always mind readers and may not always get what you're implying. Or if you're implying you might want to help, it's kind of giving them an out. So what is the project? How much effort do they need to put into it? What would the volunteer need to do specifically? What's the time commitment? How often do they need to be there, check on something? And then how do they sign up? How do they ask, or how do they raise their hand and say, yes, I want to do that? Do they just need to call you? Do they need to sign up somewhere? And then always thank the volunteer and follow up as soon as possible. I think that's kind of key. If you don't follow up right away, you're going to lose them. So sometimes it can be challenging for centers to know what projects to work on together as a care team. It's important to have this conversation with other staff at your center and brainstorm ahead of time to come up with some ideas of projects for which you're looking for a parent and patient feedback. Parents or patients may come in with ideas for projects that they want to work out, and that is great. I know that I have ideas, but I don't have all of them, and I know that there's others out there that they have way better ideas than mine. The key is to communicate with your care center and teams and talk about the projects that you both want to work on. Some examples of parent and patient volunteer activities: attend quality improvement meetings at your local center, organize a social event for parents and or patients, help organize an IBD information night, help with a specific project, join the National Parent Working Group or Patient Advisory Council. And again, the list of potential opportunities is endless. There's so many that we could try to accomplish. So in your toolkit, you'll find some of the examples of parent partner descriptions, and you can use this fact sheet as a starting point of trying to get invite parents to get involved. The good news is that there's plenty of centers out there who have parents and patients involved, and if you're part of this network, you can reach out to them and ask for help, get ideas. I know Michelle would be very willing, if you don't know of somebody, to give you a name and phone number, or put you in touch with somebody that could that can assist and help you get started. So if you're working on finding ways for parents and patients to get involved, we recommend that you invite parents and patients to join you in on that conversation. And while you're working on this, you can encourage parents and patients to sign up for the National Parent Working Group, I just said that, and Patient Advisory Council. The links to sign up for these groups are available on the ICN website, and you can find these links as well as the contact information for both groups in the Find Your Community in Improved Care Now flyer, which is page 6 of your toolkit. Making this connection of parents and patients to the PAC and the PWG is important for 2 reasons. It gives volunteers something they can get involved with as you work through figuring out what role parents and patients will have at your center. And 2, parents and patients may get ideas from parents at other care centers that they can bring back to your team. These groups have a wealth of knowledge and experience that may be able to help you. One final note on making the ask: always be sure to follow up with the volunteer. Like I said, we'll just repeat that. Even if it's just to say thank you and send a link to the Improved Care Now website so parents and patients can explore more. Following up is so important. I know in my business that I'm at, one of the running kind of jokes is that you need to drill this into, you need to state it and drill it into them at least 7 times before they will remember what you said. So if it sounds like I'm repeating myself, it's to try and help you to remember. You can find some templates of follow-up emails on pages 9 and 10 of the Recruitment Toolkit. So, chat box question: what are some of the activities parent or patient, what are some of the activities parents or patients have helped with at your center? Do you have any? Get those typing fingers ready. Meet with a new family. The newsletter. Yeah, if your center has a newsletter that you put out, that would be fantastic. Well, I gave a few examples myself of what I'd like to see. So what does Haley says? We've had at our PPAT help organize newly diagnosed IBD patient 101 night. That's huge. That's awesome. Very cool. Michelle?
Great. So it's great to hear some of these ideas of activities that you're already doing. And Haley followed up and said, starts next week. We'll see how it goes. Great. Thanks, Haley. We'd love to hear afterwards what happens. So there are, like we talked about, there are a lot of ways for volunteers to get involved, and you all shared some. I think it's really important once you start getting volunteers involved to make sure that all that information is tracked in some way. So a lot of groups that I've worked with have started out by tracking their volunteers in an Excel sheet. So it can start out pretty simple, just making sure that you have your volunteer name and contact information in one safe location. Other groups, once they've started and have gotten their groups going, have chosen to work with us and use Nation Builder as a way of tracking volunteer activities. Nation Builder, for those of you who might not be familiar with it, Nation Builder is the platform that Improve Care Now uses. It is the back end of our website and also our social media pages. Nation Builder can be really helpful as an organizing tool. It allows you not only to manage your contacts and reach out to those contacts through email, but also allows you to make notes of what activities your volunteers may do. So if you're on this call and you're looking for a tool to help you organize your group at your local center, we do have training available for Nation Builder. Our engagement team, Chris Keck and Mary Havens and myself all work on this, and we would be happy to work with you. So please feel free to reach out if that's something that sounds interesting to you. There's also an example of an Excel volunteer tracker on the ICN Exchange. So if you're looking to just start out small, which is always a good way to start and test it out, there's a template ready for you. Does anyone else have examples of how they've kept track of their volunteer information, whether it's for one-time events or for ongoing volunteer records? All right, it must be that everyone uses Excel. So I think we can go ahead and move along to talk about setting recruitment goals. Jessica?
Sorry, I put you on mute. So our recommendation is to use the SMART AIMS template. SMART stands for specific, measurable, achievable, realistic, and time-bound. Again, be specific with what you're asking for. Is it measurable? That's kind of a tricky one to figure out sometimes. How do you measure something? How do you measure how well you're doing? Part of it is setting goals. So somebody had 36 people attend their meeting. Maybe the next time you have that meeting, your goal is to have 45 people there. And how do you measure it? Did you put out more flyers? Did you do additional marketing? Did you, how did you do that? And then what was the outcome? What ended up actually happening? Is it achievable? Is it realistic? I think that's one that, we have sometimes these big dreams and ideas, but they're really far out there. And so we probably need to make sure we're realistic and start out small, and work our way up to the bigger things. Is it time bound? How much time do you have to put into it? How much time is it going to take? How much time do your volunteers have? Is it something where you need multiple volunteers to help with it? And do those volunteers all have the time to do it? So really taking a look at all of these things to make sure that we're doing our recruitment goals well. So chat box question: what is one thing that you can use to improve parent or patient recruitment at your center? What's one thing that you can do to improve recruitment? Anybody? All right. What's that?
This is Michelle. So I'd just like to share, as I mentioned at the beginning of the call, I work with the Parent Working Group, and one thing that they are doing right now, which I think is a really fantastic opportunity, is that they have a long list of parents who have signed up and said that they're interested in working with the Parent Working Group. But some of those parents haven't attended a call and they've kind of lost touch with those parents. So they decided as a group that they'd like to divide up that list and make outreach phone calls to those parents to invite them to the next couple of Parent Working Group meetings, and to ask them if they have any questions. So this is not my project, but I just thought it was an interesting idea to share. It looks like we've got a response in the chat box from Jamie Kavanaugh. Speak with providers to see if they have recommendations on families that would want to participate. Awesome. That's a really great way to build your list of potential volunteers. Thank you. Any other ideas? Any projects that you all are working on in your recruitment efforts? Since we have a little bit of time left, I thought it would be great to just open it up to any general questions you have about this volunteer recruitment process. Perhaps you've tried recruiting volunteers and you've run into some challenges. Does anyone have any questions that they'd like to share with Jessica as a parent partner or with myself as an engagement staff member?
Remember, you may have muted yourself if you're trying to speak up. So. I wonder, Michelle, while you're waiting for people to reply, you know, just thinking about smart aims, and really that's the basis of how we do things in improved care now. It's a really nice structure for thinking about this work. And I wonder if anybody could take a stab at, you know, a project they've been thinking about that, or a recruitment, you know, the thinking they might have been doing recently about parent and patient recruitment, and then based on the information they're hearing on this call, what they might, you know, if they have any initial ideas for smart aims, they could either type that in the chat box or speak up. And then if you all have tools or documents or things you've created at your care centers that relate back to anything that Jessica and Michelle have been shared, as they've said, we'd love to see those as well, because those, I think, with this great toolkit and set of tools they've developed, any additional examples from care centers are so helpful. Quiet.
Very quiet. Do you mind if I ask, Jessica, you've talked about a lot of really great ideas that you have on your center, and like as people are brainstorming their own smart aims, do you have a SMART goal that you're working on?
My goal is to be able to meet with my care center. So we just started this as being a parent, like having a parent group at our care center, and right now I'm it. I just messaged my doctor there this morning, and they're down to 2 doctors for 2 months because of whatever reason. So they're crazy busy right now. And so it kind of got put on hold for a little bit. So I'm hoping that in August, when kind of the dust settles, we're able to meet. The ICN meetings will be starting up again every week, and I'll be able to attend those and really get an understanding. I have a lot of ideas about what I want to do and what I'd like to see, but I need to know what they want too. And so I'm really trying to figure out, you know, how do I've got my ideas, and I'm kind of in my head still going through trying to figure out, okay, which one do I want to do first? How do I present this? How would I go about doing it before I even talk to them? So I have this plan already going, and kind of already prepared before we meet. So when we do meet, I can go ahead and execute it. And Beata, I saw that you were on the call, so I'll be calling you later. No, I'm excited to just be involved and to help people. I have people, friends and family come up to me, and moms and husbands, or I'm sorry, moms and wives that don't have Crohn's, but either their child or their husband does. And sometimes, even though what they're telling me is right, the person with Crohn's is maybe doesn't want to listen to them because you don't have it, you don't know what I'm going through. And I've had one of my friends at church, her husband messaged me at 9 o'clock at night, and we messaged on Facebook for an hour. He was asking questions, you know, aren't you afraid that your kids are going to get this? Well, my one kid does have it, so, you know, if the other one gets it, then it is what it is. But how do you handle this situation? What do you do in this situation? Have you ever had this happen to you before? And sometimes it's just listening and validating, and that's how you help people. I have another friend that her 21-year-old right now is he's debilitating Crohn's. He can't leave the house. They're really talking about surgery, and he's 21. He's terrified. He doesn't want to do this. But I had to tell her, I said, you know what? I had a perforated ulcer when I was 12 years old because I had been pushing off surgery. I didn't want to do it. And it was the best decision. Well, I didn't have a decision. It was thrust upon me, but it was the best thing that ever happened. So sometimes just, again, listening and validating what others have to say that's huge. That's really helpful for people. So I'm just really glad that I can be part of this and do it hopefully on a larger scale and help improve the quality for the kids in my area that go to our hospital.
Thank you so much for sharing that, Jessica. It's really amazing to hear how you are building those relationships on a local level, both with other parents and patients in your community, but then, like you mentioned, with your care center staff. I'm really looking forward to hearing how your first meeting goes. It'll be exciting to see that develop. So thank you.
Mm-hmm.
All right. Well, as we wrap up, I wanted to make you all aware of a couple opportunities coming up. First of all, I'm going to speak on behalf of Chris and let you all know that both Chris and I are always happy to talk to you if you have questions about engagement, especially working with parent and patient partners. Our contact information is up here on the slide. Chris Keck is the Engagement Campaign Director for ICN, and many of you probably have heard him speak or have spoken to him individually at this point. Chris and I have engagement office hours every Friday, and you can find that webinar information on the exchange. So again, that's just another way to reach out to us if you have questions about getting engagement efforts off the ground at your local care center, or if you have engagement efforts going and you're running into some challenges, we're here to help. So please feel free to join us on those Fridays. And then finally, I hinted at this throughout the webinar, but I wanted to invite you all to some of the upcoming engagement learning series events coming up. Obviously, this one is today, but you can also attend relationship building to support team development, how to build an engagement team part 1, and story of self, story of us, and story of now, how to talk about improved care now. You'll see that they're on a variety of days and times of the day, so hopefully we're able to reach you at a time that's good for you. And these are really great opportunities. Again, if you're looking to work with parents and patients more at your care center, hopefully these trainings give you some of the tools that you need to be successful in that. So if there are no final, and then as I mentioned as well earlier, we do have these 2 virtual info sessions in July. So I'd encourage you perhaps to invite one parent or patient who might be new to Improved Care Now and invite them to attend one of these webinars so that they get a good background of what Improved Care Now is. So at this point, I think we can do the final polls to see if this webinar was helpful for you today. And as you're answering this poll question, just to let you know that we will be sending out a more in-depth survey looking for feedback on this training. We'd really appreciate if you can take the time to do that. If you have 5 or 10 minutes later in the day, your feedback will absolutely help us improve these trainings as we continue to give them to other members of the ICN community.
Thanks, Michelle. And while we pull the polls up, I also do want to just ask and encourage if anybody has questions about the community conference. Again, the registration came out this week, or about specifically about the parent scholarship process. Please go ahead and speak up or type them in the chat box so we can give you the information you need. All right. Looks like you about 50% strongly agreed and 50% agreed. Great job. I'm glad you all got a lot out of this call. I knew you would. Michelle and Jessica have done a lovely job putting this together. and I learned something today I can try at my care center. And lots of positive feedback. Thank you so much, everyone. Well, a very special thank you to Michelle and Jessica, as well as the others who contributed to these tools. I know they have learned a lot from talking to different parents, patients, and clinicians, including some of you. And that's, you know, thank you also to Chris Keck, our engagement director, for helping make sure that this is aligned with all of the other engagement work we're doing in Improved Care Now. It's a really exciting time for engagement. We've come a long way over the past 5 years or so, and it's really nice to be getting to the point where we have a whole lot of different people in this community teaching us how to do this better. So thank you so much again to the speakers for their time, and all of you for dialing in on what I'm sure is a very busy summer day for all of you. Thank you so much, everyone.
Thank you.
Thank you.
Bye.